Colon cancer is one of the most common cancers in both men and women, and now it's one of the leading causes of cancer death. But the thing that's really concerning is that the cases are rising and in younger people. It was very rare to see anybody under the age of 50 being diagnosed with colon cancer. But today, people in their 40s and 30s, even 20s, and I've heard of even cases involving teenagers are developing colorectal cancer. Is it toxins in the environment? Is it something in our diet? Is it microplastics? Is it inflammation? What is going on? Those who ate the most foods, 45% higher risk of developing cancer in the colon, specifically the kind that's most likely to develop into a full-blown colon cancer. Eat foods that actually improve your intake because feeds those beneficial gut bacteria so you have more protection. What are the foods that can do this? Understand why colon cancer might be showing up earlier in life. We have to start at the beginning of cancer, that is. And colon cancers all start out as abnormal cells, right? So you've got normal cells, we call that normalplasia. Then you get hyperplasia, where the cells start to go a little bit crazy and they pile up in each other. And that can be in what we call in the colon an adenoma, like a polyp. So a polyp is just a bunch of cells that are piled up on top of each other until they grow, either like a mound or like a mushroom. Colon polyp, you've probably heard about. And then from there, the cells in that abnormal mound or the mushroom can actually mutate, and then that actually turns into a full-blown colon cancer. But I want to actually focus a little bit about these early adenomas or colon polyps, right? The polyps are the kind of things that you hear about that a doctor, called a gastroenterologist, spots during a colonoscopy. In fact, that's what gastroenterologists performing colonoscopy are looking for. They're looking for not colon cancer, they're looking for colon polyps, because these are the earliest signs that cancer might develop. So if you can snag the polyp, you can actually be in good shape. Let's talk about colonoscopy. This is the test where a specialist, a gastroenterologist, trained one, actually takes a long flexible tube, and while you're under sedation, they actually put that tube right up your rectum, and they can actually have a camera at the other end of it, and they can see every aspect of your colon. Now, before you get this test done, you got to do a cleanup, as we call it, and that's just taking some pills or some liquids the night before that actually make you basically have diarrhea, and you clear out everything in your bowel. That way, when the gastroenterologist looks in through colonoscopy, everything, it should be squeaky clean. You can see the walls of the colon very, very nicely. Now, what are they looking for? Looking for polyps, right? Polyps are not normal. The normal wall of the colon is smooth and glistening and pink and very, very uniform. In fact, there are kind of little ribs that you can kind of see around the walls of the colon, kind of like a slinky, you know, like a big a compressible tube. You pull it out, it stretches out with these rings. That's what the colon kind of looks like. Now, a polyp is growing right in the middle of there, popping out towards the center of the colon. So right into the tube, the cavity of the colon. As I mentioned, they can look like mounds or they can look like mushrooms. Those are all cells that are not normal, and those abnormal cells begin piling on top of each other, all right? And they're sitting inside the colon. These are pre-cancers. They're a sign that cancer might develop. And if you don't do a colonoscopy, they'll sit there, possibly for many, many years. And then left alone, they can become inflamed. And some of those inflamed cells, abnormal cells, can go on and mutate and transform into this full-blown dangerous colon cancer. Now, not all the polyps will actually be like that, but some of them could be. And that's really what we're looking for when we actually talk about screening colonoscopy, to look for hidden dangers that might indicate colon cancer long before a diagnosis of cancer is actually made. We're looking for abnormal growths like adenomas or polyps. They can look like mounds, they can look like mushrooms, and they're very distinct from the normal colon wall. And what happens is that a gastroenterologist will basically put a lasso over the polyp, all right, and squeeze it shut and pull it right out. Okay, so you pretty much amputate the polyp and pull it right out. And then that tissue that gets pulled out gets sent to the lab to see, well, is there any cancer cells in there or not? Hopefully not, usually not. But in fact, if there is sort of the beginnings of cancer, then you've actually nipped it in the bud about as early as you can possibly get, right? That's actually how you actually get the best outcomes when it comes to having colon cancer. Early detection, early intervention, much better outcomes, right? Okay, now, what is the relationship that I want to talk about when it comes to diet and colon cancer? Well, there's a logical connection because, well, the colon is part of our gut, right? So a lot of people don't think about this, but our gut starts from our mouth. That's the first part of the gut, down our throat, down our esophagus, that's also the gut, into our stomach, also the gut, and then goes into the small intestines, very important part of the gut, all right? Then into the large intestines, that's the tail end of the gut, that's the tailpipe of the gut, and then finally into the rectum, which is a kind of a holding chamber for feces or stool, and then the rectum and the anus, that's where it all comes out at the very end. But that entire shebang is actually your gut. We're talking about colon cancer, which happens in the colon. That's that end, big fat tube in gut, and we're looking for abnormal growths, early stages of adenomas, could be early cancer, and we want to nip those in the bud, all right? Now, the relationship to food makes a lot of sense because when we eat food that we eat goes all the way through the entire digestive system, and it winds up in the colon. So the cells of the colon, the lining of the colon, are exposed to whatever it is that we eat, right? Like directly exposed to whatever we eat. If what we ate had inflammatory chemicals or anything that might cause mutations or inflammation, well, you can bet that those cells in the polyps are going to actually be exposed to those same chemicals as well, right? So this actually might help you make sense on how food is connected to the health of the lining of your colon and anything that might be growing into it. What kinds of foods might be not so good for colon health? Which kind of foods might be linked to development of polyps or the precancerous stage in the colon that will lead to full-blown cancers if you just let it alone and let it tick away all by itself? Okay, I want to tell you about a study. These are done by researchers from the United States, United Kingdom, Brazil, Korea, and Japan. They were all taking part in a team of the Cancer Grand Challenges prospect study. And what this study that they did was to look at early stage colon cancer, specifically formation of the colon polyps. Remember, normal colon, normal cells, abnormal cells go to abnormal cells, piling up atop each other like a mound or a mushroom. And then some of those cells in those mound or mushrooms mutate and they go into full-blown colon cancer, a period that takes place over the course of years. So this research group studied 30,000 women for more than 24 years. That's a lot of people over a lot of years. And by the way, the women were all part of a big clinical study called the Nurses' Health Study. Now it's getting earlier, but in this particular study, the women had at least 2 early peaks inside their colon to take a look at whether it was healthy or not, right? So this gave the researchers a chance to look for any early growth before the age of 50. Remember I told you, when I went to medical school, we were always taught that colon cancer occurs, older than 50, 60, 70, but, very rarely earlier than that. But these women actually had the benefit of having that early look, all right? Now, in their study, the researchers also looked at what these women ate, okay? They had a detailed dietary questionnaire, and one of the things that the researchers focused on was ultra-processed foods. Now, you've heard this term many, many times, I'm sure. Ultra-processed foods, UPFs, these are packaged snacks, ready-to-eat meals. They're foods made with additives, a lot of additives. When you look at the ingredient label, there's 20 more ingredients, most of which you can't pronounce. Emulsifiers, stabilizers, artificial preservatives, artificial coloring, artificial flavoring, all right? And so what the researchers wanted to ask is, did the level of consumption of ultra-processed foods correlate with developing these early precancerous colon polyps, right? That's the question. Does what you eat can correlate with actually forming precancers? So here's the thing that you need to know. On average, okay, in this 30,000 group of women, the participants were eating ultra-processed foods, right, like the packaged snacks, about 6 servings a day, all right? That's about a third of the daily calories. Kind of typical in many places like the United States. And over time, 2,700 of these women developed adenomas. These are the polyps, all right, the abnormal cells that built up. And what they found is that those who ate the most ultra-processed foods, around 10 servings a day. Now, imagine that, eating 10 servings of packaged foods a day. Those women who ate that many ultra-processed food servings had a 45% higher risk of developing a colon polyp, a pre-cancer in the colon, specifically the kind of polyp that's most likely to develop into a full-blown colon cancer. That's exactly what you don't want. And by the way, the risk climbed higher step by step. All right, for every additional serving of ultra-processed food that they were eating, the risk of developing a colon polyp leading to colon cancer went higher. Why is this? I always ask, and you should ask, what's going on and what's the reason for this? The why is actually gives you the understanding so that you can take an action. Well, a couple of things that we already know goes on. The chemical ingredients in ultra-processed foods, they're pretty hard on the gut lining, the gut barrier. And when you break open the gut barrier, you're causing basically the stuff inside your colon to leak out into your bodily tissues, might even be into your bloodstream. That's highly inflammatory. And inflammation, all right, to a cancer, an early cancer is like pouring gasoline onto the embers of the fire. You can be assured that that's actually going to stoke the growth of the cancer, all right? So the chemical ingredients in ultra-processed foods are very irritating and damage the gut lining. Now, the other thing is that many of the chemical ingredients in ultra-processed foods can also affect the gut microbiome. You've also heard often about the gut microbiome. These are the 39 trillion healthy bacteria. They're supposed to be healthy, that form an ecosystem inside your gut, and they're supposed to be happy and compose of normal bacteria, and they're supposed to lower inflammation in the body. The other thing the gut microbiome does is that boosts your immune defenses, which protects you against cancer. So, ultra-processed foods increases chronic inflammation, lowers protective immunity, and weakens the wall of the gut so that actually more toxic materials actually can leak out and cause inflammation. Now, this is what happens over time, and it lowers your health overall, includes your metabolism, and it lowers your natural defenses against maintaining normal healthy cells, making precancers more likely. Here's another trigger for these early cancers, and you got to hear about this, and that's alcohol. There was a large study done from researchers at the U.S. National Institutes of Health, and they looked at data from the prostate, lung, colorectal, and ovarian cancer screening trial. This is one of the largest long-term cancer studies ever done in the United States. They looked at 88,000 adults and tracked them over 14 years. It's a long study. And they took a look at the amount of alcohol they were drinking during adulthood, and then looked at who wound up developing colon cancer. They looked at heavy drinking, and that's the important thing that you need to know, and they differentiated from social drinking. Heavy drinking is 2 or more alcoholic drinks per day. That's 14 drinks per week consistently over many, many years, okay? And that's what the study found, is that people who drank that heavily had a 91% higher risk of developing colon cancer compared to the people who were just light or social drinkers, which is really drinking one or less drink per week. In fact, the people who drank that much, all right, 14 drinks a week, they had double the risk of developing colorectal cancer. So, again, the why. What does alcohol do detrimentally? Well, alcohol increases inflammation, it weakens the gut barrier, and it alters the healthy gut bacteria, the microbiome. It makes the bacteria less healthy, more imbalanced, all right? And it's a different kind of exposure, alcohol is, than ultra-processed foods, but they actually hit the same pathway. Gut lining, gut barrier integrity, inflammation, and lowered immunity, and by damaging the gut microbiome. Same pathways. Now think about the people who might eat junk food and drink alcohol at the same time, and you can kind of see how the risk could compound. But there's some encouraging news from that last study I was telling you about, the one with alcohol and from the National Institutes of Health. The researchers also found that people who stopped drinking wound up having a lower risk of the early precancerous adenomas, the polyps. So even if you were drinking heavily, if you stopped, then your risk went down of developing the early precancers. Again, the reason I'm focusing on early precancers is that's the time to intervene, to diagnose and detect it and intervene, where you can actually get the best possible outcomes, all right? You can reverse your risk by just stopping drinking. Harmful exposure reduced or removed. And the moral of the story is it's never too late to reverse your risk. Take a step to lower your risk. Now, your body's health defenses are highly resilient. You just gotta give them a chance to bounce back and do their job, all right? So I'm going to give you some pro tips on how to cut down or cut out some of these ultra-processed foods and alcohol, of course. The goal isn't perfection or extremism. It's really just about avoiding chronic exposure to ultra-processed foods or alcohols. So my recommendation is this. When you are shopping or planning a meal, go for the produce aisles to kind of build the body of your meal. Choose whole foods and avoid those packaged foods and snacks as much as you can. Remember, you're protecting your gut health and you're protecting your colon. You don't moles, leafy greens, whole grains, all right? They all are actually really beneficial in terms of dietary fiber. Avocados, a good one. Kiwi, also good for dietary fiber. And by the way, one way to kind of avoid more ultra-processed foods is to cook at home as often as you can and cook it fresh. That way you know exactly what's actually going on. Avoid those artificial ingredients, avoid preservatives, artificial preservatives, avoid flavorings, colorings, additives, artificial sweeteners. Those are all the hallmarks of ultra-processed foods that increase your risk of developing colon polyps that can go on to become colon cancers. My recommendations are really not about restriction, all right? My whole approach to healthy diet is really inclusion. Add more good stuff that you actually already like to eat. But you do want to actually cut down or cut out those ultra-processed foods and alcohol to give your body's health defenses a chance to do their job. Reduce that inflammation, improve that immunity, keep that colon barrier intact, and that will help prevent colon polyps that can develop into colon cancer. So let's put this all together. Colon cancer, changing, showing up earlier. We didn't see this decades ago, but the science is getting clear. We now know that foods like ultra-processed foods and alcohol, beverage, can stoke inflammation, can compromise the gut microbiome, and lower your immune defenses. At the very earliest stage of the disease for polyps, that's where you want to actually alter these behaviors and materials that we're eating in order to be able to actually lower your risk of developing colon polyps. That is the encouraging part, is that your daily choices do matter. You can lower your risk by cutting down the bad stuff and adding the good stuff that you already like to eat. So small healthy habits done consistently can have a big payoff when it comes to actually lowering your risk for colon cancer. Now this is by the way, true even if you have the genetic risk for cancer. 95% of cancers are actually diet and lifestyle and environment. Only 5 to 10% are actually due to genetics. But if you happen to have genetics, you got to double down on taking these preventative steps. And of course, if you have a genetic risk, you should be talking to your medical doctor or healthcare provider and getting that screening colonoscopy. And if you have any concerns at all about your gut health or your risk of cancer, that is something that you really should be talking to your doctor about. If you found this video helpful, hit that like button and subscribe. And also, I'm going to ask you to share this with somebody who could use a little bit of